I'm going to tell you the 9 types of meniscus tears that you can possibly get and what to do next. Just so you know where the meniscus is, here's the thigh bone, here's the shin bone, this blue structure right here in between, it makes a C-shaped. And if you look at it this way, it's hard to tell, but the inside here is thin, the outside part is wide, so it makes like a wedge triangle shape if you're looking at it from the front to the back this way. Here in this first picture, we have a top-down view of the meniscus, and this is what's called a radial tear. It's just a notch in the edge on the inside part of the meniscus. Here you're looking at it from front to back. Remember, it's a wedge triangle shape. This is called a horizontal tear, where the tear has gone inwards this way. And here we have a longitudinal tear, where the tear is in the middle of the meniscus, but hasn't separated yet. That comes next. This is called an intrasubstance tear. And this is where the longitudinal tear starts to separate out a little bit, and it eventually progresses to this one down here. More on that one in just a moment. Over here we have the flap tear, and that progresses from this. When that horizontal tear starts to peel open, it can create a flap just like that. Now down here in the bottom we have a progression of the radial tear. It can turn into a parrot beak tear if it starts to turn up, kind of like a combination between a radial tear here and a longitudinal tear, like one of these two. Then here we have a degenerative tear, which comes from compression of the meniscus without really a formal accident, although these can all happen without a formal accident. These can all happen as part of degeneration as well. Here we have a bucket handle tear, which is a progression from this intrasubstance longitudinal tear. So that's when that hole starts to open up more and it resembles a bucket handle. And then here, the 9th one is what's called a complex tear, which is a combination of multiple things. Now, notice I put one of these intrasubstance tears like up here, a parrot beak radial tear and a flap tear, but you can have a double parrot beak tear or a triple flap tear. You can have all kinds of combinations. That would be called a complex meniscus tear. Now, people split hairs over the type of meniscus tear and what treatment you should be doing next for it, but I am here to tell you that with all of these meniscus tears, if you take pressure off the meniscus, it tends to heal and begin to act like a normal meniscus. Even though you have a tear clinically, like visible on your MRI, you can have a painless meniscus tear if you allow it to heal properly. And the way to take pressure off, initially you want to use crutches to offload your leg, but then you have to fix the root muscle imbalance, which means you have to get certain muscles stronger to put your muscles in balance around your knee joints, because that puts the normal forces on the meniscus. Usually the quad muscles on the front of the thigh above the kneecap right here are too dominant, too strong, and because of their attachments down here to the shin bone, it'll pull the shin bone up excessively and smash that meniscus, and that's what leads to all those different types of tears. If you can get your quad muscles in the front of your thigh to not be so dominant and not be so strong, and usually you got to get the glute muscles up in the back of the hip stronger, that tends to balance out the strength to normalize the forces in the knee joint on your meniscus. I've developed a program called the Knee Meniscus Recovery Program, which is especially focused on addressing this root muscle imbalance. You can learn more about it in the link in the description below. I've also got links to all our meniscus playlists if you want to see more of our videos here on YouTube. Hey, thanks so much for watching. Please give us a thumbs up if you thought this was helpful, and please subscribe and turn on your notification bell so that you don't miss out on any of the helpful videos we post every week. Thank you so much, and I hope to see you in the next video. Bye-bye.